Hello, everyone. Welcome back to MediFriend. Today, we are going to talk about a very important heart disease called cardiomyopathy. Many people have heard this word, but do not clearly understand what it means. So in this video, I will explain what cardiomyopathy is, why it happens, what symptoms it causes, how doctors diagnose it, and what treatments are available. Make sure you watch until the end because this condition can become very serious if ignored. Cardiomyopathy is a disease of the heart muscle. Normally, the heart is a strong muscle that pumps blood to the entire body. It beats continuously without stopping and supplies oxygen and nutrients to every organ. But in cardiomyopathy, the heart muscle becomes weak, thick, or stiff. Because of this, the heart cannot pump blood properly. When the pumping function becomes weak, the body does not get enough oxygen-rich blood, and this leads to many problems. There are different types of cardiomyopathy. One common type is when the heart becomes enlarged and stretched. The muscle becomes thin and weak, and this reduces the pumping power. This is called dilated cardiomyopathy. Another type happens when the heart muscle becomes abnormally thick. When the muscle becomes too thick, it becomes harder for the heart to pump blood out. This type is often genetic and can run in families. There is also a type where the heart muscle becomes stiff and cannot relax properly between beats, so it does not fill with enough blood. No matter which type it is, the main problem is that the heart cannot function normally. In the beginning, some people may not feel any symptoms at all. The disease can stay silent for some time, but as it progresses, symptoms start appearing. The most common symptom is shortness of breath. A person may feel breathless while walking, climbing stairs, or even lying down. Swelling in the legs, ankles, or feet can happen because fluid starts building up in the body. Many patients feel extreme tiredness and weakness because the muscles are not receiving enough oxygen. Some people experience chest pain or pressure. Others may feel their heart beating very fast, pounding or skipping beats. Dizziness and fainting can also occur, especially in certain types where the heart rhythm becomes abnormal. Now you may wonder, why does cardiomyopathy happen? In some cases, it is inherited from parents, meaning it is genetic. If someone in your family had heart muscle disease, your risk may be higher. In other cases, long-term high blood pressure can strain the heart and damage the muscle. Previous heart attacks can weaken the heart. Heavy alcohol use over many years can also damage the heart muscle. Viral infections sometimes attack the heart and cause inflammation. Conditions like diabetes, thyroid disorders, and certain autoimmune diseases can also lead to cardiomyopathy. However, in many patients, doctors cannot find a clear cause. When someone comes to the doctor with symptoms like breathlessness and swelling, the doctor will first perform a physical examination and ask about medical history and family history. One of the most important tests to diagnose cardiomyopathy is an echocardiogram. This is an ultrasound of the heart that shows how well the heart is pumping and whether the muscle is thickened or enlarged. An electrocardiogram is also done to check the heart's electrical activity and rhythm. Doctors may order blood tests, chest X-rays, or a cardiac MRI to get more detailed images of the heart. In some families, genetic testing may be recommended. The treatment of cardiomyopathy depends on the type and severity. The main goal of treatment is to improve the heart's function, reduce symptoms, and prevent complications. Doctors often prescribe medications that help lower blood pressure and reduce strain on the heart. Some medicines slow down the heart rate so it can pump more effectively. Diuretics are commonly used to remove extra fluid from the body and reduce swelling. If there is a risk of blood clots, blood-thinning medication may be given. If the heart rhythm becomes dangerous, special medicines or devices may be needed to control it. In more severe cases, procedures may be required. Some patients need a pacemaker to regulate the heartbeat. Others may need an implantable defibrillator, which can correct life-threatening arrhythmias. In certain cases where the heart muscle is very thick, surgery may be done to remove part of the thickened muscle. In advanced stages where the heart is extremely weak and does not respond to treatment, a heart transplant may be considered as a last option. Lifestyle changes play a very important role in managing cardiomyopathy. Patients are usually advised to reduce salt intake because salt increases fluid retention. Avoiding alcohol is very important, especially if alcohol contributed to the disease. Smoking must be stopped completely. Maintaining a healthy weight and doing light, doctor-approved exercise can help improve overall heart health. Controlling diabetes, blood pressure, and cholesterol levels is also essential. If cardiomyopathy is not treated properly, it can lead to serious complications. These include heart failure, blood clots, valve problems, severe arrhythmias, and in some cases, sudden cardiac death. That is why early diagnosis and regular follow-up with a cardiologist are very important. The good news is that with proper treatment and lifestyle changes, many people with cardiomyopathy can live long and stable lives. The key is early detection, proper medication, and consistent medical care. If you found this video helpful, please like, share, and subscribe to MediFriend for more simple and clear medical explanations. If you have any questions, write them in the comments below, and I will try to answer them in my next video. Stay healthy, stay informed, and take care of your heart.